Your show was better when you had medical questions. AIDS!
You get nothing. You lose. Good day, sir.
He's a fucking idiot.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios in beautiful downtown OJ City, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And Lady Diagnosis. Hello, Lady Diagnosis.
Hello, Dr. Steve.
Good to have you back. And my partner in all things, Tacie. Hello, Tacie.
Hello.
This is a show for people who never listened to a medical show on the radio or the internet. You got a question you're embarrassed to take to a regular medical provider if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POO-HEAD. Follow us on Weird Medicine, at Weird Medicine, or at DrScottWM, at Twitter or X or whatever that shit it's called. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Check out stuff.drsteve.com. That's stuff.drsteve.com. If you know someone who plays a stringed instrument, get them a roadie, robotic tuner. You can see that at stuff.drsteve.com, or you can just go straight to roadie, roadie.drsteve.com. And they also have a thing called the Roadie Coach, which will teach somebody how to play their instrument. So if you know somebody that's bought themselves a guitar and it's just sitting there because they like a lump because they don't know what to do with it, get them a Roadie Coach. So that's roadie.drsteve.com. Check out Dr. Scott's website at simplyherbals.net. And check out our Patreon, patreon.com/Weird Medicine. I'm just putting everything up there, just the kitchen sink. You'll find something there that you like. And we can chat with each other. You can ask questions there. Every bit of video content that I ever make, including our shorts, normal world appearances, and that kind of stuff, all show up on patreon.com/Weird Medicine. And then if you want me to say fluid to your mama or whatever, I'll do it at cameo.com/Weird Medicine. It's dirt cheap. Unless you're a business, and that's $250. And that's the minimum that they'll let you charge. It's like I would charge $10 to just, do something, not necessarily endorse something I don't know, but just to say, yeah, check out, Joe Smith's podcast or whatever. But the minimum you can charge is $250. So I'll never, why would anybody pay me to do that?
You do have a good voice, Dr. Steve.
Yeah, but I don't have any credibility when
you
it
are
comes
on
to
IMDb.
That is true. All right.
He has a point.
And don't forget Dr. Scott's website at simplyherbals.net. Simplyherbals.net. 'Tis the season for nasal congestion.
All things nasal congestion.
And check me out at Normal World at youtube.com/@normalworld or on Blaze TV. And we've got the Ask Dr. Steve segments and they let me act a little bit. I actually have an IMDb page now, Tace.
I've had one for years.
I know. It's true. It's true. Tacie's had an IMDb page for a video game, which I don't want to dox her, but she's had one much longer than
What
I
does
have.
that mean?
Well, Internet Movie Database has when people act in something, and for some reason it has video games in it too, you get an entry on there. And so Tacie had one because Laszlo, wanted. He said, "Do you know anybody that sounds real country?" And I'm like, "Yep, I surely do." And I really wanted to get Tacie's mom in there, but I was afraid that she just couldn't take direction. She'd get all flustered and stuff. So, well, you want me to say what? Just you can imagine. So,
yeah.
So we had Tacie and her friend Wendy and a couple other people. And she's had this stupid IMDb page I was jealous of. And then all of a sudden I was just checking it one day and mine popped up. And there's like Dr. Steve, cult leader.
Oh, yeah.
And Dr. Steve, psychiatrist and stuff
go.
like that. So, yeah, it was kind of fun.
Nutcase.
Yeah, Dr. Steve, idiot. Anyway, it's normal world. All right. Tacie, you got some topics today?
I sure do.
All right.
Cool.
It's Tacie's time of topics. A time for Tacie to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacie.
Well, hello.
Hello.
FDA is to finally ban controversial ingredient in popular decongestants.
Uh-oh, here we go.
Sudafed, Mucinex, Benadryl, Advil, Tylenol, Vicks, and Dimetapp. These popular brand names appear on oral decongestants that are staples of the cold and flu aisle in American drugstores, and yet many contain an ingredient that does not work as promised.
Phenylephrine.
The U.S. Food and Drug Administration has now proposed an order to remove oral phenylephrine from every single cold, cough, allergy, bronchodilator, and anti-asthmatic drug product available today. Roughly 4/5 of all oral decongestants.
Yeah, so they say on their website, it's the FDA's rule to ensure that drugs are safe and effective.
Yes.
Phenylephrine's been in this shit ever since Sudafed.
Day one, yeah.
The druggies found out that they could make methamphetamine out of Sudafed, and it got put behind the counter. So all the over-the-counter stuff has phenylephrine in it.
I agree with this because if you don't have Sudafed in a cold medicine and you're really sick, that phenylephrine doesn't do shit.
Yeah.
It really doesn't.
Yeah, I've always, as a decongestant, always, rather than taking a pill that goes to the tip of my toes and, my fingers and stuff, just to get to my nose, I just use topical stuff, either Dr. Scott's nasal spray, or I use oxymetazoline, which is the, generic or the active ingredient in Afrin and all those other sort of spray decongestants. That stuff is great. The problem is that if you use it over and over and over again, you'll get addicted to it. And it's really, addicted is not the right word. You end up getting rebound nasal congestion. So when it wears off, those tissues re-expand and they overshoot, and now you have even worse nasal congestion.
That happened to me.
So did it? Mm-hmm. Were you habituated to that stuff for a while?
Yes, I was. It was when I was pregnant.
Oh yeah, well you're fluid overloaded then anyway.
Yeah, it was awful.
So my ex, she used to use like 2 or 3 of those Afrin bottles a day.
A whole bottle?
Yeah, she just constantly. She was so habituated to it. It was really funny. But anyway,
it took a couple of days of just not doing it.
Yeah,
and just not breathing.
When your nose is that congested, it's almost like you can't resist spraying that stuff up there. I've had it where I could feel the turbinate. So those are sort of the active tissues in there just smashed up against my nasal septum, and it's just unbelievably uncomfortable. And you can't eat if you can't breathe through your nose, because I just gasp because I'm like trying to eat and then I can't breathe, and I'm you can't taste anything. It sucks.
No good.
Got to be a mouth breather for a couple of days to get over
just
it.
Gotta be a mouth breather.
There actually, if you do get habituated to oxymetazoline, what we used to use were 2 things: the Breathe Right nasal strips combined with the Atrovent nasal spray. It has ipratropium in it, and it is non-habit forming. And although it's mostly decreases mucus production, it has some decongestant activity as well, and that would help to get people off of this. And Tacie's right; it only takes a few days, and then you're back to normal again. But it does suck.
Mm-hmm.
It doesn't say when this stuff will be off the market.
Well, it's a proposed order.
Okay.
So what it is only the final order affects which products can be marketed. So they are asking for comments on this right now. Now, I was going to look at PubMed. So PubMed.gov. Oh, no, that's a government website. No, it's the repository of the National Library of Medicine. Calm down. So I've had people, I've said, look, let me pull up this article from PubMed.gov. And they're like, well, I don't trust that. It's like, okay, it's not, they're not affiliated with those that you don't trust. So let's see. Okay, so phenylephrine and inhaled nitric oxide in adult respiratory distress syndrome. One or two better than one, and there's no abstract, so I have no idea what the answer to that is. Let's see here. Here, the phenylephrine saga, a drug dilemma. Also no abstract. The impact of hyperoxy and phenylephrine on cerebral oxygenation. Okay, let's see about this. So it says, patients undergoing craniotomy, in other words, brain surgery, under general anesthesia, brain tissue oxygen tension increased with high inspiratory oxygen fraction. There you go, of course, but remained unchanged after a bolus dose of phenylephrine. So in other words, the phenylephrine didn't help there either. So, yeah, here we go. Now, this is from Ophthalmology 1980.
Oh, wow.
This is probably where this came from. Phenylephrine is a potent, effective, and relatively safe drug with few ocular side effects. Side effects from topical instillation are uncommon. So back in the 80s, the common wisdom was that this stuff was safe and effective, and that's why it got stuck in, let's say, over-the-counter decongestants when Sudafed went behind the counter, because nobody wants to sign a registry just to buy a nasal decongestant. No. But anyway, if you have short-term nasal congestion and you don't want to mess with phenylephrine because it's been demonstrated really not to be very effective and the risks outweigh the benefits, try the Afrin. Just don't use it 3 times a day, every day for 2 weeks, and because you will get habituated to it. We used to recommend 4 days max. And if you can use it just before you go to bed, that's even better. All right, good one, Tace.
Good one, Tace.
Next.
Okay. Okay.
Did you have another one? Because
yeah.
I have one.
GLP-1 medications may reduce risk of overdose.
Oh, okay, so what's the deal on that?
What you might know as the newest craze of weight loss drugs could help with substance abuse. GLP-1 medications like Ozempic and Wegovy mimic natural hormones in the body that regulate blood sugar and insulin levels. They're used to treat type 2 diabetes and obesities. These drugs curb the craving for high-calorie food, helping users eat less. A new study published in the journal Addiction showed that it could also be used to reduce cravings for opioids and alcohol for those struggling with substance abuse.
Really?
Mm-hmm.
That's surprising.
Because these receptors exist in different parts of the body, like the brain, there may be some options or possibilities in the future to use them for other types of conditions. What do you think about that?
Yeah, that's interesting. That's a surprising one to me. I mean, just because it makes you stop eating, it's not because it works on pain and pleasure.
I was going to say pleasures enter somehow.
But it must.
Yeah.
Well, so many drugs, people go, well, why are you using, I don't know. This isn't a good example. Methadone for pain when they use it to get people off drugs. That's kind of a different situation. But lots of medicines have different activities. Mm-hmm. For example, aspirin is great for arthritis pain, but also helps to prevent a heart attack and stroke, and prevents colon cancer in some people who are at high risk. So all these 3 completely different things. Mm-hmm. So lots of medications have different activity.
The study did not prove these drugs directly lowered the risks of opioid overdose and alcohol intoxication, but that it seemed to help. Those who took the drug had a 40% lower chance of overdosing on opioids and a 50% lower chance of getting drunk compared to those who did not take the medication.
So they will have to redo those studies with that as the primary endpoint and do double-blind placebo-controlled study before they can market it.
Unless maybe
they do not have approval.
No.
Unless maybe it has something to do with the delayed gastric emptying of the
maybe
or breaking down the pills, breaking down the alcohol. It just sits in your stomach for longer.
Maybe I don't know.
More.
Yeah, yeah, interesting.
Yeah, it's kind of bizarre.
We've had a lot of stories about those GLPs recently.
Yeah,
the one from last week dealt with surgical risk. And we realized that it's because of delayed gastric emptying. People can be what we call NPO after midnight. In other words, not taking medication or oral intake after midnight and still go in and have a full stomach and end up aspirating in the operating suite. So nobody wants that.
No, that's bad.
Yeah.
So my next article is about Paragoric.
Yes, I really wanted you to do
And
this
has
one.
it been banned by the Food and Drug Administration?
The answer, no.
Okay. All right.
Yeah, go ahead.
This person is saying that they remember using this product occasionally as a teenager back in the 1960s, and it was a miracle drug for stopping diarrhea.
Yeah.
And it was available over the counter. Mothers would rub a little on their teething babies' gums to decrease
teething
their pain. Yeah. Nowadays, I do not see Paragoric mentioned on any schedule of drugs. Many pharmacists have never heard of it. I don't know if that's true because I've heard of it.
That's right, of course.
Although it appears to be available in other countries, I don't understand why this drug that helps so many people is taken off the market. It certainly couldn't be any more addictive than codeine, which is still widely available.
Right.
I'm 74 now and would like to have some Paragoric on hand when I get diarrhea.
Okay, I see.
And the answer...
This is one of those Q&A things.
Yes.
Yeah.
The answer is that Paragoric is a derivative of opium, sometimes referred to as a camphorated tincture of opium.
Correct.
It's an extract of opium along with some other traditional ingredients like anise oil, benzoic acid.
Is that right? That's why it tastes like licorice? I always thought that opium just tasted like licorice, but they actually put anise in the Paragoric. So they make it taste like licorice.
Gotcha.
Yeah.
Interesting.
And it's in a base of alcohol and water, and because of abuse, it was made a controlled substance.
Of course. It's opium.
And although manufacturing stopped briefly, it is still available, and I suppose your pharmacist would get it if your physician ordered it. However, there are more effective and safer drugs for diarrhea, like loperamide and diphenolate,
which are also
atropine.
Both stimulate the mu-opioid receptor, and the other one has atropine in it. Oral atropine can cause dry mouth, delirium, disequilibrium. It can cause bladder outflow obstruction. So I'm not a fan of that. Who is that? Who's answering these questions?
It's Dr. Roach.
Is it an actual doctor, or are they just playing one on TV?
Dr. Keith Roach, To Your Health, and it's published in the Detroit News.
Okay, so. I'm not sure I completely agree with that those are necessarily safer and more effective. The thing about diarrhea is you need to know what you're treating.
Why do you have it? Yeah.
Right.
Yeah.
And you shouldn't, just because you have loose stools, shouldn't necessarily be taking medication. For example, if you have Shigella or Salmonella, they recommend that you don't slow down your bowel movements because you're just trapping the bacteria in your colon and allowing them to breed and multiply even faster than they already did. And then some people have things like malabsorption, and they take loperamide, which they can buy over the counter. It's sold as Imodium, and they'll buy that. And they'll slow down their stools, but they don't realize they're not treating the underlying problem, which is the malabsorption. In other words, they're not able to absorb fat, and they continue to lose weight, and they lose essential fatty acids and fat-soluble vitamins and all kinds of shit. So
literally.
I think that, right. Well, thank you. So, but the... I think the advice that I would have given had I been writing that thing is, Paragoric is fine, but don't just treat diarrhea without knowing what the cause is. Transient, short-lived diarrhea, totally fine. I don't really care what you use for that. But if it's just going on and on and on, you got to do something about it and get it worked up. Okay. Now, Paragoric, I used to prescribe it in primary care all the time. And then what I found out what was going on is that you get a little 1-ounce bottle of this stuff. Remember, we used it on our kids' teeth when they were teething
maybe
for
that's
like a day.
How I know about it.
Well, we used it for like a day, and you would take the bottle and just tip it over onto your finger, and then take your finger and rub it on their gums. And then, 2 days later, their teething pain is better, or, a week later, whatever. And now you've got a bottle that has an ounce minus 1/100th of an ounce.
Right.
So you basically have an ounce of tincture of opium. And what people were doing is they were dipping joints and dipping cigarettes in these and then putting them in the dehydrator or putting it in the oven at low, like 170 or something. And then when you smoke it, you're smoking opium in Upper East Tennessee.
Oh, my goodness.
So it's crazy. So that's the deal with Paragoric. I've seen people put it, and I'm not advocating this. I'm just saying this is what I've seen people do. Put it like on a plate or a metal plate and put it in the oven and just sort of smear it on there. And then when it dries out, scraping it and then smoking that. And then they're actually literally smoking opium.
Sounds like a much better option.
Well, no, it doesn't. That's not a good option, Dr. Scott. No. That's Dr.
It's a
Scott.
terrible idea.
It's because you're an idiot.
Is there a group for these people that want to
groups.
quit? They meet in the church basement.
Yeah, they are groups.
Well, then they run out of it. If you keep going, well, I need more of that Paragoric. My kid's teething
I'm
pain.
in for the teething drops.
It's real bad, don't you know? It's like, that's bullshit. No one ever needs more than one of those little tiny bottles of Paragoric. So that's a self-limited thing. Anyway, all right.
Crazy.
Those are all my stories.
Well, thank you very much.
You're welcome.
You get a bell for those.
Uh-oh.
Myself a bell.
I got a bell, Scott, so screw you.
Yeah,
this is what Scott gets.
Get your hand off my penis!
All right. I have a story. A UK man's aggressive brain tumor was cut down in size by 50% following a first-of-its-kind treatment for a type of cancer that typically kills patients within 18 months. So that would be glioblastoma. And so this guy he was an engineer. He was diagnosed with glioblastoma back in December of 2023. And what they did was they removed as much of the tumor as they could surgically, and then they implanted a tiny device called an Ommaya reservoir right under his scalp. So what that is it's like a, I don't know, like a little balloon that you can inject stuff into, and then it will excrete that through a tube into the surrounding area. Okay, so that's what so they put this Ommaya reservoir in, and after they placed it, they injected low levels of radioactivity directly into the tumor once a week for 6 weeks, and it was aimed at killing cancer cells while leaving the healthy tissue unharmed, because regular brain tissue is relatively resistant to radiation, and the glioblastoma cells are less so. And brain scans that they reviewed revealed that his tumor reduced in size by 50% at the end of his 6-week treatment. And that's pretty incredible, because now what we want to see is, if they do a bunch of these, we want to see if survival is increased.
Right.
Because it could be that you have more adverse events with this, or you have other issues that make this not a viable treatment. But right now it looks pretty good. Wow. And he says, he said before he saw the remarkable results, it would be wonderful if this treatment helps me, and if it doesn't, it doesn't. It may benefit someone else down the line. So that's the right attitude to have when you do an experimental treatment like this. You're always advancing medical knowledge. So, all right. They're going to have 40 patients treated in phase 1 of the trial over the next year. So we'll keep you informed on that. Glioblastoma is one of those. I hate that one. That one is devastating, because at some point it affects the person, not just their body, because it's in the brain. And I would like this was a really good target to defeat, because it's hard to get medicine there because a lot of the medicine won't cross the blood-brain barrier, and you don't want to kill other brain tissues, so you're killing living human cells inside a living human cell, or in a living human body, and part of it is, or substantially, or all of it in this case, is in the brain, which makes it even more difficult. So it's a tough one. So good for them. I like the idea. All right. Questions, comments? Lady Diagnosis, you got anything?
I just have a question. I have a friend that has an issue with, she's allergic to exercise.
Oh, yeah.
So when she sweats, she gets hives and breaks out immediately and then itches like crazy. But it doesn't last long. I don't know how long, maybe half hour, 2 hours.
Sure.
And there's no explanation, is there?
There is. Sure there is.
Or cure? Is there a cure?
There's treatment. She has exercise-induced urticaria. Yes. This is also known as cholinergic urticaria. It's rare. And
you know who has that, Steve?
Well, who's that?
Liam's fiance.
What?
Mm-hmm.
Really? Mm-hmm. Well, she was a cheerleader.
I don't know.
Okay. All right.
There you go.
Well, every once in a while, exercise can trigger a more severe reaction called exercise-induced anaphylaxis. And that's a rough one because, you exercise and then you feel short of breath because you're exercised, but actually what's happening is your lungs are shutting down and you don't get better. As a matter of fact, it can be fatal.
So this just came on one day. She was in her 20s.
Right, this happens.
Oh, okay.
Yep.
So no cause.
Nope. Nope.
Interesting.
Nope. So the treatment of exercise-induced urticaria involves the avoidance of exercise.
Oh, I wish I had that, man.
All right. Now, because exercise is good for you, that's a crappy answer. So you can use things like fexofenadine before you, that's Allegra, non-drowsy antihistamine. I'm going to also say that mast cell stabilizers like the leukotriene inhibitors like montelukast or Singulair would be helpful. And I know that they've been proposed, but they need studies to establish their effectiveness in this. The problem is, again, it's a rare disease, but I would do that. And then they say avoiding food for 4 to 6 hours prior to exercise has been mentioned across the literature as a way to help prevent food-dependent exercise-induced urticaria. So some people only have the hives when they exercise if they have food in their stomach.
Well, do you know if your friend, does she get the hives only if she sweats?
Yeah.
I was going to say, exercising, but just not getting to the point of getting your body too hot.
Yeah.
Lots of little sessions, I guess.
Well, yeah, you can do just weight training and do just steady.
Well, I mean, she could see what the threshold is, but it's probably not the sweating; it's the actual exercise. But it could be the sweat. Yeah. She may be allergic to her own sweat or something. But then, when she's hot, she should be having this, not just when she's exerting herself, because you sweat other times, So this person. In this study that I'm looking at, gradual modification of exercise was an effective treatment, and they worked their way back, tolerate low-intensity exercise without the use of antihistamines in this person. So, but I would want to be able to do what the hell I want to do, so I would try Singulair if it were me first. And montelukast has its own issues with adverse effects, but it is generally safe and well tolerated by people who can tolerate it. Those that can't, it's pretty outstanding how bad the adverse reactions can be. But that's rare. I've only really seen one case of that, and that was in a friend of ours' kid. So, all right.
Yes, thank
So
you.
continuing on allergies here, Amanda from the fluid family has a good question.
Amanda 5x5.
Yeah. She's got a cat that, since she's moved to Florida, has developed allergies. And she went and had her cat.
She's developed allergies to the cat, or the cat has?
The cat has an increase in allergies.
Okay.
Takes the cat in, for testing, and I guess the cat is now allergic to humans.
What?
Well, that's hilarious.
Isn't it awful?
Well, that's because,
God,
when you're
that's
allergic to a cat, you're not allergic to the cat. You're allergic to their dander.
Right.
So wash your hair more often, Amanda. Maybe that's dander.
Maybe,
It's
a
human dander.
few more showers or a little, what is it? Some Gold Bond powder on your.
Wow.
Yeah. So, but she was asking if humans can actually be allergic to humans. And I guess
that's a good question.
I'm just going to tell you, I've seen people allergic to things you would never think they would be allergic to. So
you can be allergic to sunlight.
To anything. So
we've had people on this show that were allergic to sunlight. If they went outside, they started sneezing and maybe got hives or itchy.
Well, if you got in lupus, you're going to be sensitive to.
Well, that's a sun sensitivity where the skin actually is truly sensitive to ultraviolet.
Yeah.
It's not that's not a an immediate type hypersensitivity reaction.
Okay.
It's just their skin is sensitized and it burns and turns red more easily. Yeah. But this is what we're actually talking about, an IgE mediated allergy.
Okay,
where
good.
histamine is released. The cells degranulate, and all of a sudden the histamine and all those other active substances are released, and you get skin swelling and redness and itching, and then you get running of the eyes and nose and all that stuff too.
I had a friend who was allergic to food.
Yeah.
Yes.
Yeah, no, there's some people are allergic to cold drinks. Some people are allergic to hot drinks.
Yep.
Some people are allergic to their stomach being full. One person can be allergic to another. It's extremely rare. There's one that, this doesn't really count, but dermographism is where you scratch your skin and you get a hive there. There's this thing called people allergic to me, and it's someone claims their body odor causes allergy-like reactions in others, but I think that's just because they just smell bad.
I'm with you on that one.
Yeah. Now, autoallergy, there are people allergic to parts of themselves, and those are people who have sex allergy. So when they ejaculate, when the semen touches the mucous membrane of the urethra, it triggers a allergic reaction. They can feel really sick, and they'll have malaise, and they can have hives and stuff like that. And as long as it stays inside the seminal vesicles and the prostate, it doesn't seem to bother them. It's just when it's released, which is crazy. And then there's this thing called mast cell activation syndrome. I had a friend in medical school who had that. We went skiing, and she would just faint out of nowhere, and her blood pressure would drop. And it causes people to be allergic to almost everything, including the scent of a loved one sometimes. So it's just where their mast cells, which are the cells that have these globules of histamine and all these other sort of vasoactive substances in them, they just release their substances for no reason. They've got a hair trigger. They're supposed to only do it under certain circumstances, when they meet certain allergens from the outside, certain foreign bodies, stuff like that. But in some people, they just go, okay, well, fuck it, and they just give up the ghost. And now you've got these people having these horrible allergic reactions to most everything. So
is there something that triggers these automatically, or is it something that builds up in your body and
nobody
then your
knows.
body you have no clue?
You get exposed to something that the body misrecognizes as foreign, and then the next thing you know, you're off to the races. So, for example, I guess an example would be, like diabetes type 1. The immune system attacks the islet cells, or as they say in China, according to Dr. Scott, the islet cells. It attacks those, and what they think it is maybe you're exposed to a bacterium or a virus that when has some protein on the surface, that when the body attacks that, it also looks like a protein on the surface of the islet cells. And so those antibodies are running around looking for targets, and they've killed all the viruses. Well, hell, there's a bunch of targets over here, and they're all your own islet cells, and the immune system just kills them. So you can think of your own analogies that go with that, but it's just basically a deflection. The immune system attacks one invader, and then when it's done, it sees other targets inside the body that it shouldn't have seen, but it's just what happened. And, the receptors on the surface of that virus had receptors that looked like receptors on the islet cell, and so now it goes and kills it. Think of the Opie and Anthony Forum. The pests were there to support the Opie and Anthony army, and all of a sudden when Opie and Anthony went away, they had nowhere else to go, so they attacked the host, and they started, attacking Opie and Anthony and Patrick Tomlinson and a bunch of other people because they just, the activity was there, it just didn't have a target anymore. Right? That makes sense?
No.
No? Really?
I don't know who those people are.
Well, it doesn't matter, but can you figure it out from the context?
I can, yes.
Like a fan base.
I got it, Dr. Steve.
A fan base, when the thing that they're a fan of goes away, if that fan base was there to kind of fuck with other radio shows and stuff, which they were, they shut down Facebook pages of rival radio shows and all kinds of stuff. When the sort of directing force goes away, then
they need a new target.
Think of mercenaries.
Yes, no, that makes
if you
sense.
hire a bunch of mercenaries for something, then you just don't pay them; they're going to turn on you.
Oh yeah,
right.
Yep.
Okay, that might be another way to look at it. All right, let's see here.
There you go.
Number one thing: don't take advice from some asshole on the radio.
Very good, thank you, my friend. Let's see what we got here. This one is called "Wash Your Stupid Nuts," but I think this is okay. Now, what this is a reaction to something Dr. Scott said 9 years ago. So I'm going to hold your feet to the fire.
Yes, I just want to tell Dr. Scott that it was hilarious when he told the guy that had a urination smelling problem that all he needed to do was wash his nuts. I know, I'd laugh for 5 minutes because the irony of it, because 2 minutes before that he said that he wasn't funny. But anyway, wash your nuts if your piss smells. That's fantastic.
There you go.
I will do that.
Right. Lady Diagnosis, next time your piss smells, wash your nuts.
I'm washing my nuts.
You go.
Yeah.
I'm full of great ideas, buddy, I'm telling you.
You so smart.
That's ramble smart.
You so smart.
He's a fart smeller. I mean, smart feller.
Oh, my God, that's hilarious.
Good one, Dr. Scott.
Hi, Dr. Steve.
Hello.
First of all, let me say how much I love your show.
Oh, thank you.
But I also have a question. I have been a smoker for about 7 years now.
Okay.
And I've just recently quit. But I am still smoking a vaporizer.
Yeah.
It's completely helped me stop smoking cigarettes. I was smoking probably about a pack a day. And now I'm not really smoking cigarettes at all. But my question was, how do you feel about the vaporizers? Because I don't know. I assume they're better than cigarettes.
Yes.
But I don't know all of the health precautions, maybe. I don't.
Yeah, no, it's a good.
Well, the bad thing is they're more accepted, so you can do it anywhere.
Yeah, and even a lot of places now are like no vaping, but I always find it very humorous when we see people just going down the road and you see these giant clouds.
Clouds of smoke.
And Liam and Beck used to, when we went to Asheville, which there are quite a few hipsters in Asheville. Surprise, surprise. Spoiler alert.
One or two.
And there was this guy, and they still talk about him, and he had this vape pen, and he was like a hippie Joe guy, and he had one like white glove and all this stuff, and he was just sitting out there acting cool for wanting people to notice him. And he had this vape pen, I swear it looked like a clarinet. I mean, it had all these contraptions. It was black and silver and all this stuff. And I remember us just going, looking at him and just taking a toot off of this thing. And these giant clouds of smoke or steam or vape or whatever. And you know that can't be good for you. Cannot be.
There's no possible way.
And he was just like, oh, I think I'll take a toot off of my vape. And then, whoa. And the boys just made fun of him because it was obvious he was just there with his cool vape pen to just draw attention to himself. But it is Listen, it's undoubtedly safer than smoking.
Okay.
As long as you're not using one of those old knockoff vape pens that had vitamin E in it that was causing people to have permanent lung damage.
Right.
And they sell a nicotine inhaler. Nicotrol or Nicorette or one of those sells a nicotine inhaler. So, and it's designed to help people get off smoking. That is prescription strength, and it is reimbursable by your insurance. So that might be something for people to think about. For those that just can't stomach the thought of switching from smoking to gum. You know, they have that thing in their hand.
Oh, sure. Yeah,
Tacie used to smoke. Lady
Yeah.
Diagnosis, did you ever smoke?
Never.
Oh, okay.
Yeah,
well,
she's too good.
whatever. We smoked 3 packs a day. I smoked 3 packs
Loser.
a day.
Thank
Tacie
you.
smoked a pack a day at least at one point.
Yep.
And just having that thing in your hand and just the whole concept of putting something to your mouth and inhaling it. And Dr. Scott's got different sort of thoughts about tobacco addiction because he put those squibs. Did you do squibs or did you do the actual dip?
Oh, hell no, I did it all. I did it all. Pinch between the cheek and gum.
Yeah, little Twix cheek and gum. I would never put something in my mouth that looked like that when it came out because it just
man.
looks like you're shitting into a Coke cup.
It was wonderful. Then a big old chew tobacco sometimes.
Oh,
Oh my gosh.
Nope.
Ain't nothing like it.
Nope.
That was
not.
when
Thank God.
when I was in high school, we had a fraternity, and the induction to the fraternity was you had to do this big chaw, this big thing of chaw, and hold it in your mouth for like 15 minutes.
That's a terrible idea.
And that's why
That's vomited.
that
Kids are mean.
cured all of us.
That is vomit.
of ever doing that.
That's going to make you vomit for sure. Yeah, the nicotine in there. You know, that Copenhagen is what I'd chewed and what I like the most. And they have little fiberglass in that thing that actually rubs your lip raw, and you get a buzz of nicotine.
Oh,
just
because
like,
it.
Oh my gosh!
Really?
It's unbelievable.
That's not good for you.
No,
either.
it's terrible.
That's awful.
Oh, my
That's why I
God.
love it so
Well,
much.
Yeah.
so the vape pens just have nicotine and vapor in them.
Okay.
The cigarettes have 10,000 toxic things in them, including carbon monoxide and stuff like that. The tar causes the cancer. The nicotine promotes its growth. So nicotine alone still is not safe. But it is safer, and I'm okay with people using a vape pen for 6 weeks or 8 weeks to get off of smoking, but then you got to get off of that. Rich Voss got off of smoking X number of years ago. It was a long time ago, but he's still addicted to the gum, the nicotine gum. He can't break it, or he won't break it, or doesn't want to, whatever it is. He's still using the nicotine gum.
Can I ask you a question about those vape pens? Are they they're not as hot, are they, as far on your
Correct.
like smoking cigarettes? So that's
Right.
also part of it too. Is
Yeah.
not being so hot.
Well, you're not combusting, so you're not making you're not making carbon monoxide
Right,
and
okay.
other sort of products of combustion, which are known to be
the heat.
cancer inducing. Now, Tacie, who's that person we like? Teresa Lazarelli or something like that. Then all she does is test vape pens.
Oh.
Yeah, her name is Teresa Larzilleri, I think. And she does these reviews, and she's one of my favorite people on the internet right now. So we spent how many hours watching her at the beach
I mean,
with everybody?
hours and hours. It was very entertaining.
Yeah, so let's see here. Okay, Teresa's going
What is up, and I got a review for you. What is up, and I got a review for you guys. I'm going to do a review on the Box Air Bar, and the flavor is orange shake.
Now, here she goes. Now she's taking a
big toot.
It's nice and smooth.
Yep.
It's nice and sweet.
And it tastes like an orange. Because she'll always say,
Stating the
this one's
obvious,
yeah, well.
It tastes like an orange shake.
There you go.
Bingo.
Because it's called Orange Shake. She is my favorite. Her YouTube channel is basically her testing all these different vape pens, and she loves them all. Did you ever hear her say, I don't like this one?
No, and she likes to say it's nice and smooth.
They're all smooth.
And they're so funny.
And there's
they really
one
are
that's
so
blueberry ice, and she said this one tastes like blueberries and ice. And then one time she said, this one tastes like a blackberry soda. Have I ever had blackberry soda? No, I have not. If you've ever had blackberry soda, comment in the. I'll put a link. We love her. She's the greatest. So
good stuff.
And so she's pushing the vapes. I hope she's okay. But I'm okay with vaping short term, not long term.
So was the vitamin E what was causing what they called popcorn lung?
It caused one of the chronic lung diseases. I'm not 100% sure it was what caused popcorn lung, but there were people having horrific permanent lung damage, and it turned out that the vape manufacturer was using vitamin E to solubilize the flavors. Like, why did they do that? They must have just gotten a vat of it cheap and said, well, it's an oil and it's vaporizable. And it was not something you wanted to inhale. That's my understanding of what went down. If I'm wrong, somebody feel free to correct me, but from my extensive research that took 3 minutes, that's what I got. All right. Yeah, this one from Nick Illig, who is brother to
So
Captain
RFK
Mike.
Jr.'s doctor discovered a third testicle during an exam. He said, I think this is what is messing up your voice, but it's also probably making you pretty virile. But I think we should still remove it. So he removed it, and it actually helped his voice quite a bit. But Bobby and Cheryl missed the third nut and asked the doctor for it back. And the doctor said, that's impossible, it's been destroyed.
He put it on himself.
It's not bad. Not bad, Nick.
Funny.
Our new chief of Health and Human Services or whatever. What is it that RFK is going to be? He's doing something with healthcare. And the legacy media is going crazy. You know, vaccine denier, RFK in charge of our health care. And it's like, he doesn't deny vaccines. He was not.
He just says he doesn't like them.
No, what he said was he didn't want mRNA vaccines to be mandated until they were approved by the federal government, and they never were. So that's why. But that's his thing. Talk to him about it. I'm just repeating what he said. All right. Okay, I don't know what the hell this
Hey,
one
Dr.
is.
Steve, long-time listener, long-time fan.
Hey, thanks, man.
So I have a question for you, and if this isn't weird, I don't know what is.
Okay.
For the longest time, I've enjoyed, while I was in the shower, turning on the water really hot
Yeah.
and taking a shower head and pretty much, just having the water in my genitals.
Yeah, okay.
I don't know why. It just feels amazing.
Well, it's called washing your genitals. I mean, who hasn't done that?
Well, he probably has stinky urine.
Scalding.
Oh, yeah, he might have had stinky urine. That's right. Oh, this might be that same guy.
But, it's hot enough to where I guess I've gotten used to it, but if it hits my leg or any other part of my body, it's really uncomfortable.
Okay.
And I've been doing this as long as I can. I remember. I'm 28.
Okay.
And I'm not sure this is a good idea. I imagine it's not, but...
Well...
He's scalding his private parts?
That's what it sounds like, yeah. Now, the testicle, if you want to be fertile, the testicles have to be 3 degrees below body temperature. And you might go, well, it's too hot for those. And, they say if you get in a hot tub, that can affect fertility and those things. But transient increases in blood flow really shouldn't cause that much problem. So if he's just doing this for a minute or two, not a big deal. I know that the skin of the genitals is weird because when I was a kid, I made the mistake because when I was a kid, we didn't have like shea butter and all that stuff. You had Vaseline and you had Vicks Vapor Rub laying around.
Oh, no.
So I beat off using Vicks Vapor Rub. I guess I was 15, and it just kind of had a warming sensation. Wasn't that big of a deal
initially.
As soon as I completed the transaction, though, it was like, oh my God. My junk is on fire, and it switched just like that as soon as the orgasm was complete.
Oh.
Isn't that weird? And and lots of other things switch. Like I know people, they'll have intercourse with somebody, and then they'll bust a nut, and then they'll go, oh, as soon as they're over, they'll go, shit, what did I just do? Whereas 30 seconds before that, they were all in. Mm-hmm. You know, so there is this weird switch that turns off or turns on or turns to a different state. Mm-hmm. And I think it has some evolutionary thing going on that, you know, the evolutionary drive is to procreate. Mm-hmm. So even if there's some discomfort, you're going to endure it. The brain's going to turn it off until you're done. Mm-hmm. You know, presumably impregnating somebody, and then now it's fine if it hurts because it doesn't matter. Yep. But try getting Vicks Vapor Rub off of your genitals with soap and water. Impossible to do. Mm-hmm. It's impossible. Mm-hmm. So all you can do is wipe off as much as you can, wash it the best you can, and then just endure it until the pain goes away. It's the menthol that does it. Mm-hmm. But anyway. Yeah, so
Vicks Vapor Rub. You're funny.
Well, I was a kid. But yeah, I mean, it was squishy and seemed like it would work, and it did up until it didn't.
Until reality kicked in.
Yeah, it was horrendous.
Oh, jeez.
All right.
Fuck yeah, Dr. Steve. This is Chip. I'll tell you something. Kuda is the right way to pronounce it. That's how they say it in Chinese medicine. Kuda. All right, bye, Dr. Steve. This is Chip again. All right, going way back. All right. Fuck yeah, home run. Bye.
Double guns, Chippa. All right. I don't know. He was making fun of Dr. Scott about something.
Obviously.
All right.
Hey, Dr. Steve.
Hey.
Me and my wife, we recently got a genetic test done.
Yeah.
She came out positive for the BRCA gene.
Yep.
And I came out positive with the ATM gene, or ATM gene carrier. The question is, I have 4 kids.
Yeah.
What do I need to do to protect them?
It's a great question. Do you know this APM gene?
I was going to say, what's an ATM gene?
Was it ATM gene, did he say, or
that's
APM
what he said.
gene?
That I don't know.
Okay. I now I know what he's talking about. So there's an APM gene that predisposes people to obesity. The ATM gene is a cancer protection gene that helps repair DNA damage. So if you have a disordered one, that you're going to be more at risk for cancer. So it's also called the ataxia telangiectasia mutated gene. Now, so let's talk about the BRCA gene first. So this is a gene that predisposes people towards certain cancers. And if you have that gene, each of your children has a 50% chance of inheriting the mutation. Now, knowing that you're at risk for something means you're less likely to die from it because you're going to catch it because you're going to go through surveillance. But what you want to do is your kids need to be tested down the road because they have an at-risk parent. And with this ATM gene, they have 2 at-risk parents. So the likelihood is that half of your kids will have the BRCA gene if genetics were perfect. You can flip a coin and get tails 4 times in a row, so maybe none of them will have it.
Right.
It's possible. Half of them will have this ATM gene, and then the question is some of them will have both, and the ones that have both need to know that. And the ones that have the actual gene and it's being expressed need to know that. So when they get of age, just have them tested.
So if they have kids, if they have the gene and they have is it a disorder, disease, will they be more likely to pass it along, or does that matter?
Right, 50%.
Either way, whether they have it or not.
Right. If they have it, it's 50% if they've got 1 copy of the gene.
Gotcha.
If they don't get anything,
they don't pass it. Okay.
Right. Yep. Right. And if they don't have it at all, then they're free and clear. Yep.
Okay.
All right, Dr. Scott. Well, before we get out of here, let's look at the Fluid family. If you want to join the Fluid family, go to youtube.com/@weirdmedicine. Click join. Click subscribe, click the notification button, and you don't have to pay anything to join if you don't want to. Just click the button that says accept gifted memberships, and Look at there. Myrtle Manus gifted 10 Weird Medicine with Dr. Steve memberships. Mm-hmm. And I noticed Gina Bobina got one, and several other people who have been in this chat room before. So, all right, very good. And that's all I've got from the chat room, unless you have anything that says we shouldn't be injecting minutes-old babies with hepatitis vaccines. Okay, which I can see an argument for. That was somebody talking about RFK.
Oh, yeah.
And do they do that? Do they give them hepatitis vaccine when they're minutes old? No.
I don't think so.
I mean, unless they're just talking about lots of minutes. They do inject them with vitamin K and some other things.
Yes.
And that's actually a good thing.
Yes.
So, all right. We obviously need something with our healthcare system. Something's got to be better. It's crazy to me that what I understand is we as taxpayers are funding the healthcare system in another country that's at war with another country, and that people there have their healthcare for free, and we're paying for it. Now, if that's not true, then I got that from the legacy media. So I'll have to do some research on that before I make any assertions about it. But if that is true, it kind of bugs me that I have patients who lose their jobs because they have to go get chemotherapy every 3 weeks, and now they lose their house, or they run through all their money, and then they are tempted to sell their pain medicine because they can't pay the rent anymore, et cetera, et cetera, et cetera, and putting pressure like that on people when it's possibly avoidable. And I'm probably the only libertarian light person you'll ever meet that's in favor of single-payer health care, because I'm sick and tired of having to wonder every time I write a drug, is their insurance company going to pay for it?
That's gotta
because
be.
They're all effing different.
Yeah. Mm-hmm.
Hey, yeah, I agree. Real quick, we got one question that slid in under the line.
Okay, good.
You ready for it?
You're probably getting me out of trouble, so good.
I'm interrupting on purpose.
Yeah.
Hey, Golden George wants to know: is there a reason why the inflammation in his neck is not going down 6 months after spinal surgery?
Yeah.
So there's a couple of reasons.
Go ahead. Take that, because that happened to me too. I didn't have surgery, but I had an injury and it didn't go away.
Yeah. A lot of times, depending on what kind of surgery he had, and if it's a spinal surgery on his neck and they came in from the back of his neck, maybe they had a dated disc or a fusion, a lot of times the scar tissue will build up, and the muscles will actually build up around that scar tissue in the neck, and it looks like swelling. And it's not fluid, it's not fat, but it's actually muscle that's trying to pull the head back in place after the surgery. So it's kind of a protective thing, but it's also trying to pick your head up and to straighten it up. So if that's what it is, it's actually something we treat pretty well with the acupuncture.
Yeah.
Because we put needles in those muscles and fatigue and some stem and
physical therapy, physiatry would help.
Well,
any of those.
Not so much this early.
Okay, I see what you're saying.
And the reason
he just had it?
Well,
what did he say? How many months?
6 months.
Yeah, 6 months. Yeah.
Okay.
Yeah. I think the physical therapy right afterwards to regain movement.
Correct.
I mean, initially,
you're saying this late in the game.
Well, yeah, but also this early. If you let it continue to go, those muscles get thicker and thicker in the back of the neck.
Yeah.
Because they're trying to pull the head back into extension.
Okay.
And if you can work on getting the fascia to release, and where the scar tissue is, a lot of times that swelling will go down. Yeah, and usually the sooner I get to him, the better.
Okay.
Yeah, assuming that he doesn't have, an infection or some kind of cerebral spinal fluid leak, which they would have known already.
Well, in my case, I've always injured myself. Are you okay? What happened?
Yeah, this chair keeps. I'm not even leaning on it. It keeps breaking.
Okay, well, I'll
we'll
fix
get you
it.
better. We'll get you better in a second.
I wish I had a camera on you right now. It'd be humorous, but I fell down the stairs. The one time I've fallen, and I landed on the side of my neck.
Scared the shit out of me.
My head, right, because she was just worried that she wouldn't know how to turn the remote on.
Who's going to get dinner?
Yeah, and the TV still doesn't work in the bedroom.
Oh, really? Well, I can fix that.
FYI.
Okay, what'd you try to do? Nothing. It's okay. I'll take care of it.
Turn it on, it don't work.
It don't work.
But when I did that, it didn't hurt right away. But then after a couple of days, then the healing starts, and that's when the pain starts. And then it didn't go away, and it didn't go away, and it didn't go away for months. And I was like, "What the hell is going on? Why am I still having pain for an injury when my body should have healed that a long time ago?" Well, at my age, maybe human growth hormone has been shown to enhance healing in elderly people. Mm-hmm. Maybe I could have tried that. But what I ended up having to do was get an epidural injection in my neck of steroids.
Right.
And that's why I was recommending physiatry or anesthesiology pain clinic, because, if they can put the steroids directly where the inflammation is, assuming there's no infection and nothing else like Dr. Scott is talking about, that may calm that down. You could do the acupuncture first because it's way less invasive.
And
painless. And then do that. Well, I tell you, it didn't hurt when I did it, and within a week, I was back to normal again.
Yeah.
So I was really happy that I did it.
Yeah, we got a little clarification. He actually had it from the front.
Right, correct.
No, that's what Golden George said.
They go through the front of the neck when they do that
for the injection. Yeah, but Golden George just said his surgery was not what I was talking about, a posterior approach.
No, I'm saying he had
an ACDF, which is anterior
correct
cervical disc.
I've never known them to do it any other way. To be honest with you, everybody I've ever had that's had unless they put in a cage,
right,
that's had a disc removed in the neck, they do it through the front, which seems crazy,
right?
But apparently it's way easier to do.
Yeah, so he said he's still having some pre-surgery signs and symptoms, and the swellings at the base of the neck. So he's got a lot of. Sounds like some other levels may be involved.
Well, that may be.
Yeah,
that may
which
be.
would be my guess.
So they'll want to do some imaging, make sure everything's where it's supposed to be. And then, you can never go wrong going to see Dr. Scott. Just make sure you see someone with a D.OM after their name.
Yeah.
And that means that they went to 4-year Chinese medical school. It's not just some schlump who took a weekend class in acupuncture. And then if that doesn't work, absolutely a physiatrist.
Absolutely physiatrist, yeah.
Or a physiatrist is a
interventional anesthesiologist. We'll do it too. Yeah.
That's right. Yeah. Physiatry is a medical subspecialty. They don't have an ology name because physiology was already taken. And the real name of their subspecialty is physical medicine and rehab. But when you tell people you're going to send somebody to physical medicine rehab, they go, "I ain't going to no nursing home." Mm-hmm. It's like I know it's the name of the subspecialty. It's very confusing, and but they can do some things that regular doctors can't do. Okay.
All right, let's do it.
All right, sounds good.
Wrap it up.
All right. Well, thanks. Always go to Dr. Scott. Thanks, Lady Diagnosis. And thank you, Tacie. Thanks to everyone who's made this show happen over the years. Listen to our Sirius XM show on the Faction Talk channel. Sirius XM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern. But on demand is the place to listen to it, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.